joining us and carrying this important news conference live. We have a lot of information to get to as our community deals with the impact of coronavirus, and we want you to know that part of this news conference is to let you know how we plan to take care of our community. The speakers today will be Orange County Mayor Jerry L. Demings, Orlando Mayor Buddy Dyer, Dr. Raul Pino, Health Director, Florida Department of Health in Orange County, Dr. Yolanda Martinez, Director of Orange County Health Services, Orange County Fire Chief James Fitzgerald, and Candy Crawford, who is the President and CEO of the Mental Health Association of Central Florida. Mayor Demings.
All right, thank you, Jane. Thank you to all of you for being here today. We are living in some unusual times that call for unusual measures. I want to thank our county commissioners, constitutional officers, Mayor Dyer, and other local leaders for being here today. Within the past 24 hours, a lot has changed in the world around us, certainly here in the U.S. and certainly within Orange County. We are now at a critical point in the coronavirus threat. New cases of positive tests are being determined daily throughout Florida. I want to acknowledge that we've had one case within the Orlando metropolitan statistical area at this time, just one case, and that was a case in Seminole County. We have learned that an Orange County resident who was traveling abroad died in California from the COVID-19. Our hearts and prayers certainly go out to that family. Dr. Raul Pino will give you an update on the cases in just a few moments. At 8:50 this morning, I signed an executive order declaring a local emergency for Orange County. The Emergency Operations Center is now activated and fully staffed to manage this crisis. The order makes me the Director of Emergency Management during the period of the order. I want all Orange County residents to know that we do have a plan to deal with this. I'm confident that if we all work together to support this plan, we will minimize the spread of the virus. For nearly 4 decades in this community, I served as a public safety official and managed numerous crises during that period of time. The Orlando metropolitan area has gone through many challenges over the years, and we are a resilient community that has faced down adversity, and we've survived through all of them. You may recall that as a nation and as a community, we endured the events of 9/11. And in 2004, we experienced an extraordinary season of storms. In the summer or fall of that year, we had 3 hurricanes within a 6-week period of time, and we survived it. This COVID-19 outbreak is similar to what our community went through in 2004. We are cautiously optimistic that the issues related to the COVID-19 will be done in 6 to 8 weeks. But if that is not possible, we are prepared. Together as a community, we got through those times, and together we'll get through these times. I'm asking the community to trust in your government. We will not let you down. Just a few days ago, I had the opportunity to attend a hearing conducted by the Florida delegation to the U.S. House of Representatives in Washington, D.C. And at that meeting, the cruise industry discussed the effects of the coronavirus on the industry. And it has had a multi-billion-dollar impact on that industry. My observations from that is that all of Florida, all of America, before this is all over, this virus will have a multi-trillion-dollar impact on us. But today, I want to announce to you some particular things that we're doing here within Orange County. We are recommending that gatherings of 250 people or more be postponed or canceled. Working together, our goal is to stop the spread of the coronavirus so it does not march further into our community. We do not want it to march down your street. We do not want it to march into your households, which is why we're taking the actions that we're taking today. As the Orange County Mayor, I want you to know that we are making plans to look out for those who will be feeling the economic impact of COVID-19. We know that jobs are being impacted and families are being impacted, and we will be making decisions to assist families in need in the coming days. But the bottom line here is we will get through this together. And I pledge to keep you fully informed every step of the way. Our goal is to keep you and your families safe. Before I go to Mayor Dyer, let me just talk to you briefly about some things that we're doing here within Orange County. Our parks program will cancel any gatherings facilitated by the county for those in the senior age group. Typical programs impacted will be fitness classes, leisure activities, dances, and other activities or gatherings at Orange County facilities. County staff will communicate directly with our partners and group leaders to inform them of the cancellations and postponements. County communications will continue to include postings on our website through social media and additional postings as things change. Those who attend our senior facility at the Renaissance Senior Center and the Marks Street Senior Center will be impacted by these decisions. Seniors First will be making alternative arrangements for those seniors who attend the congregate meal and site programs at the Marks Street Center. Although the centers will remain open to walk-in clients, we are encouraging our seniors to refrain from visiting until further notice. Orange County spring break camps will continue as planned, although off-site field trips will be canceled. We know that spring break for our Orange County Public Schools has started. The county special events, which typically draw large attendance, will be postponed, including those on March 28th at Fort Christmas Historical Parks, the Bluegrass Festival, and other events going into April will be posted on those that will be canceled. County-run youth sports leagues will be suspended until further notice. Youth sports partners such as Little Leagues and youth soccer leagues have begun voluntary cancellations on their own. And the Parks Division will work with these organizations to resume normal operations after the crisis. Today I want to also acknowledge that we have representatives here from 211, which is our social service line, and the United Way. I'm going to, at this time, turn it over to Mayor Dyer for additional comments, and then we will have other key speakers who will share information as well. Mayor Dyer.
Thank you, Mayor Demings. As you know, the top priority of our city government is the safety of our residents and our visitors, and we're grateful to our citizens, our businesses, the other local governments that have responded to the threat of COVID-19. And Mayor Demings is exactly right. We're all in this together. We have to work together. We have to coordinate. Our main purpose is to slow the spread of the virus and to mitigate its impact on our community, both economically and health-wise. Today, I've also issued a state of emergency for the city of Orlando to further our efforts in fighting the spread of the virus and to give us quicker access to needed supplies. We want you to continue to take rational and reasonable measures following the guidelines and health habits recommended by the Center for Disease Control. I think we've all talked ad nauseum about washing your hands and using hand sanitizer and not touching your face, so I won't reiterate those. But the safety of the public is obviously at the forefront of all of the decision making that our local governments are making, both for our employees and the public. So I want to make sure that you understand that we've consulted with the county, and we're going to follow the same standard in terms of mass gatherings through the end of the month. We're going to use the same numbers, so whether you're calling the city or the county, you're going to get the same information related to that. We have a full list of events that have been canceled. Similar to the county, we're canceling city events through the end of the month, so the plant sale at Lou Gardens, the Sunday Farmers Market in Lake Eola Park are examples of those events. One thing that I want to emphasize is I want to encourage residents to look out for those people that are the most vulnerable in our community. Contact your family, your friends. We know that the number I like to use is 65 and older because I'm 61, but some people say 60 and older are more susceptible to, and those with chronic medical conditions. That's not to say that anybody that catches the virus in danger, but they're more in danger of spreading it to somebody that's in one of those categories. We likewise have suspended all of our activities related to seniors, so the Beardall Center and the L. Claudia Allen Senior Center will be closed, but also senior activities at our other community centers will also not occur. We will be keeping the community centers open, however, for all of the youth activities, so our summer camps are going on, after school programs and that sort of thing. For all information on that, you can visit orlando.gov COVID-19. So we've got a long history of working together in this community. Everything we've done from Sunrail to Medical City to building our community venues is because we've been able to work together for the common good of our entire community, and that's what we need to do in this crisis. If you think about it, most of the tragedies or disasters or natural emergencies that we've had have been localized, whether it's a hurricane or a mass shooting somewhere. This one encompasses the entire country, and we have to respond as a country, but more importantly, we have to localize it and do everything that we can in our community to make sure that our citizens and our visitors are safe. With that, I'll turn it over to Dr. Pino.
Good afternoon, Raul Pino, Orange County Health Officer. You know, the message that we have for our community is that these steps that the administrations are taking should not be seen as a reactive to anything else but a preventive measure to diminish the possibility of transmission within our communities. So that social contact has been seen around the world as one of the main modes of transmission by droplets. So what we are trying to do, our political leaders are trying to do, is to minimize the possibilities of transmission when it gets here, because it will get here eventually. And it's already, as the mayor mentioned, in Osceola County, which is next to us. Seminole County, which is next to us. So it's a matter of time. With that, also, we want to inform you that an individual, as the mayor said in his statement, have died in California. The person is a Florida resident that was never in Florida since acquired the disease in Asia. So this person was in isolation in California and have died there. We will not be able at this point to provide any further information on the individual with respect to their privacy. And our prayers and thoughts, of course, are with families and friends. With that, I will give the microphone to Dr. Yolanda Martinez, who is the director of the Department of Health Services.
Thank you very much, Dr. Pino. Good afternoon. I just wanted to reiterate what both Mayor Demings and Mayor Dyer and Dr. Pino have said. It is important for us to consider as we go about our daily activities and we now get preoccupied about what I need to do next, how I need to prepare, not to forget to continue to exercise social distancing. If you're coughing, if you have a flu or have symptoms of a flu, please cover your cough as you're approaching other individuals. If you're around the elderly, your grandmother, your grandparents, your parents, also exercise extreme caution. And we want to again mention what Mayor Demings and Mayor Dyer have reiterated before. It is that we have worked together since the very beginning to make sure that the community is safe, the county is safe. And I recall back to when we first started hearing about the cases in China, Dr. Zuver, our medical director, immediately convened a meeting with our community partners, the hospitals, the airport, fire rescue, the health department, so that we could start brainstorming how we need to prepare for this and be ready. So we just want to again reassure everybody that we are working hard and everybody is on our mind to make sure that we deliver the best safety for everybody. Thank you very much. I'll turn it over now to Chief Fitzgerald from Fire Rescue.
Good afternoon. I'm Jim Fitzgerald, the Orange County Fire Chief. As first responders, our primary mission is the health and safety of the residents and guests of the communities we serve. We accomplish this mission by working in partnership with our local municipalities, as well as state and federal officials, to ensure that we have the necessary response plans and protocols in place to protect both citizens and first responders. We pride ourselves on being prepared and well-trained to respond to the needs of our community. An example of this past week, your firefighters and paramedics visited more than 80 assisted living facilities, much like we did during the last hurricane season, checking on our most vulnerable population, ensuring that they had the necessary safety literature in place and answering any questions that they may have. We ask that you continue to practice those recommended safeguards of avoiding close contact with people who are sick, staying at home if you're not feeling well, and washing your hands frequently. I also want to assure all of you that the emergency responders within Central Florida are well prepared and well trained to respond to your needs. We do it every single day. If you need us, do not hesitate to call us. At this time, I want to call on Candy Crawford, CEO, Mental Health Association of Central Florida.
Thank you, Chief. We have a lot of people out there that are very anxious, and we want to help them as much as we can. We provide assistance to people. We have absolutely no financial screening for anyone that calls our office, whether they have insurance or no insurance. We have a mental health connections program that will help anyone that makes contact with us. No one needs to come to our office. We're available online with an application online to tell us what they need from us. They can call us on the phone. We have our own clinic, a free clinic that doesn't charge anybody. In fact, we don't charge any patient for anything. And we have a new system of where we can provide telecounseling to people. They don't even need to leave their home. So if someone is in isolation or they are sick and they need some counseling, they can be screened through the Mental Health Association, and we can provide that counseling to them. So we have a lot of services that we can provide right now, and I have these cards with me. I have 500 of these cards with me that I can hand out to anybody here that's interested, so people can know how to get in touch with us. But we're there for them. We're there for anybody, and we serve the 5-county Central Florida area, and I would encourage you to take advantage of what we have. We're the safety net for the community, and we're there for you. Thank you.
Okay, you've yes. If you have any questions and you want it interpreted in Spanish, yeah, we have some people that will make available to you immediately afterwards. But if there are other questions at this time, Okay.
My people down there in Baltimore, there's a ratio of people that are 60 and older, and I did my rounds today as a leader of the community, and there's no disinfectant, there's no toilet paper. These people are not ready to go, or nobody's taking them to Walmart. The conditions of the infrastructure around the Baltimore area call for the virus to spread rapidly because there's no cleanness on the area whatsoever. And the homeless community is in camps of not be able to get any information about a vaccine, how long we're going to be closed. The closures are affecting the entrepreneurs downtown. The closures are affecting the people that live of the economy. You did that. So it's very serious for us. There will be no information whatsoever in the Palmer area. There will be no official.
Okay, I think we got.
We need answers. We need answers.
We got a gist of your question at this point, and I'm going to ask Mayor Dyer to respond to some of them, but I can say this to you as well. I can say this to you. We have a number of social service agencies here within. Let me finish, sir. Let me finish.
We're not eating. We don't have nothing to eat, bro.
Okay. All right.
Jose, settle down, okay?
We don't have no food down there.
Settle down, Jose, okay?
I've been with you for balls and with you for...
Settle down, Jose, okay? Settle down.
You got a big pocket, we don't.
Settle down. The issue that I think we can address for you is issue related to the homeless population that we have here in Central Florida.
The business, you shut down the arena, you shut down all the games, people are not parking, they're not eating. It's real bad, man.
Settle down now. So the issue that he raises is the issue of we have a homeless population in downtown and in other pockets that certainly is a population that would be susceptible to a rapid spread of the virus. We have been in contact the last several days with all of the organizations that provide services and assessing what their needs are and how they can continue to help us communicate directly with the homeless. So we are certainly aware of the issue, and it's like everything else. Every 24 hours it seems like it changes in terms of our response. If you had asked me certain questions on Tuesday of this week, I think I'd had entirely different answers than I would have had on Wednesday, Thursday, or even today. So we are dealing with these issues as best we can as they come up, but the homeless population is absolutely on our radar screen.
Don't sugarcoat it, bro. The people are entrepreneurs there. When you cancel all the shows,
Jose,
there's no money going to power whatsoever, bro.
Right now, we're aware, as Mayor Demings has mentioned, of the economic predicament that this is going to put people in. We're working in whatever way, especially we want to see what Congress does in the next few days in terms of a relief package. We want to see what the state government puts in the appropriations bill here towards the end on the assist, because we can't do it alone to solve the economic part of this. But our job today is to make sure that we quell the spread of this virus, because if we have a whole neighborhood that is impacted by contracting the virus, then that's going to be a whole nother situation for us.
In many ways, this community, this part of Florida, survives with tourism. With the theme parks closing, what can you tell people of how that economic impact is going to roll through the community, and what it's going to mean at just about every level, because tax money is also going to serve that?
This is going to impact everybody, especially the hourly worker. I think of restaurants here that host various events that probably aren't going to go on. I think of my friend Wendy Connor, who runs the Abbey, who's had every event they have canceled for the next several weeks. So we know that it's going to impact people from the very top, large corporations that are going to lose profits. But more importantly, it's how it's impacting the worker that needs to get by on that weekly paycheck or monthly paycheck. So we're in uncharted waters here. We don't know the extent of the impact, but it's certainly going to be severe. And you pointed out our tourism economy is certainly susceptible.
Wait, Mayor, you can also address that.
What I would add to the question, at this point, just with our convention business in Orange County, it's just south of $300 million impact within the last week or so, based on some of the show cancellations. And Mayor Dyer is correct. We don't know exactly what that ultimate impact would be, but it is impacting us right down to our families, which is why we are doing the press event today. We have engaged, as you can see, a number of people from our community here. I'm going to ask our 2-on-1 our United Way executive director to come forward and just kind of share with you some things that we're doing. We all know Jose. He's from our community here. We work with him on a regular basis to try to deal with the needs of our community. And so he's really the face of some of the individuals who may suffer the most in our community when the number of hours on their jobs are reduced. But fortunately, our theme parks have said that their employees who may not be coming to work, they're going to continue to pay them as if they were working. From our local governments, to the extent that we can, we will be making adjustments and appropriate decisions. From the private sector, yes, they're going to have to make some decisions about how they will care for the needs of their employees. And we're waiting on the federal government to say to us what types of stimulus packages will be made available to assist individuals. That is something that I know personally is being discussed within the halls of Congress. I was there just yesterday and the day before, and I know that there's some discussion there, and we'll get more from the federal government and our state as well to make certain that we're able to take care of really all Americans. And so these are unprecedented times that we are living in right now, and we're trying to do our best as a local community. You know, all of these issues begin to impact our families right here in the local communities, and for that reason, we're trying to assemble a team and develop a plan to be able to address that. So, Jeff, if you'll just come forward and talk about some of the things that you are doing to make certain that families are taken care of as well. They advised us of their decisions. They contacted us telephonically, and we really have been in communication with them routinely now for the last several weeks, talking through this. In the eventuality, we got to this particular point in time. So we're consistent with our messaging here, and many of the provisions that we've talked about today will be put in place until April 1st, which is consistent with the period of time that they're closing the parks. We'll reassess, depending upon the developments, the specific developments of how the virus impacts us here locally. We'll have to make some decisions and adjust over time. Okay. Let us go to some of the social services at this point, and then we'll come back to questions. Okay.
Thank you, Mayor. My name is Jeff Hayward. I'm President and CEO, Heart of Florida United Way. 46% of the families in Central Florida were already ALICE, that is asset limited, income constrained, but employed. And they call our office each and every day, as Mayor Demings alluded to. We run the 2-on-1 information and referral service, and they call our office every day looking for housing assistance and utility assistance and so on. We had a meeting on Monday, and we had one set of facts, as Mayor Dyer said, and then we had a meeting yesterday, and we had a whole new set of facts. We are responding as quickly as we can to those families who are calling. Our 2-on-1 call center is also the Center for Disease Control backup for the flu on call. They've converted us now. We're accepting coronavirus calls, and we're tracking those each and every day. And we're looking out now into the community as to what resources there are. Here's the catch-22. When the market falls and people begin to get worried, they don't give to charity. They don't give to human service organizations through donations. So the number of dollars available fall. At the same time, because of this scenario, the number of requests for services are rising. So United Way is answering 24 hours, 7 days a week, calls to 211 if you have any questions about how to protect yourself, what to do, where to get testing, and so forth. We'll also be answering calls continually for human service and social service calls for those who might be out of work because they are hourly employees and are now their hours are cut back or eliminated completely. What we'll now be doing is reaching out to the community, as we did after Hurricane Maria, and ask for the generosity of community and to see what resources are out there so we can increase the number of dollars available for those families who are going to be impacted. As Mayor Dyer said, everyone is being impacted, our businesses and so on. They're having to lay off. Thankfully, many are paying their employees, and many are unable to do that. So we as a community, as Mayor Deming said, we've got a history of coming together. We will come together on this one and respond to those families' needs the best we can, but we can't do it alone. We will need the community to step up as well.
One of the things that I would add here is one of the reasons why we have activated our Emergency Operations Center is so that we can pull the public, private, and philanthropic sectors of our community together to be able to respond in a timely manner to whatever the needs are of our community. So in terms of even food, we know that we're going to have to increase the throughput to our food pantries that will ultimately serve the residents of our community who are in need. If they, because of reduced hours of work, if they struggle, we want to be able to catch them and to help them through that period of time. And so that's the purpose of having the Emergency Operations Center activated at this point. Okay, now let's go to other questions. I'm going to go to the back and then I'll work forward.
Mayor,
yes.
do you have enough testing right now, testing supplies to be able to handle this need? We're hearing from people daily that they feel like they need to get tested and can't.
Okay, the Florida Department of Health really is the entity that is on point for this health crisis here within Florida. In terms of testing kits, I know that they're working with the federal government on increasing the number of testing kits that will be made available to our healthcare providers, and that number really on a daily basis is increasing. I'm not sure that it is necessary for Dr. Pino to respond in addition to that, but Dr. Pino, if you have additional information you want to share, certainly.
So part of our current efforts are about to increase capability to do more testing independently of the ER, because part of our efforts is also to deviate people that don't need to go to the ER from clogging the ERs. So on that, we are preparing, with the help of the county, a location in our county that could be ready mid next week, if everything goes well, where we will be conducting testing. With regard to the supplies, we have limited supplies. So in testing, you have to keep two things in mind. One is the collection kit to collect the sample, and one is the test kit. For the test kits, the governor has ordered sufficient test kits to test about 650,000 Floridians. As soon as those supplies start coming, that will increase our ability and capacity to do testing. At the same time, we have to increase the number of collection test kits that we don't have as many as we will need if we open to the public. So before we open to the general public, we're using the limited resources that we have in the people that meet the 3 CDC criteria for mandatory testing. That's the Department of Health. Now, other institutions in Orange County are conducting testing on their own. That is independently of what I'm saying to you.
But Dr. Pino, can you tell us today, if someone is having symptoms, what is the best way for them to do testing?
So if anyone is having symptoms, and people have to keep in mind that we're also going through the flu season, and a lot of people are having flu at the same time. So what is important is to establish, do we have it or do have it? And at the ERs, for people who are having symptoms, and they feel that they need to go or the breathing is compromised, they should go to the ER. Now, people that are just experiencing symptoms and have questions, they could call our numbers, and we will triage those individuals there. Now, what I can tell you, if anyone needs to be tested, it will be tested. But it's a difference between being needing testing and wanting to be tested. And that's the difference that we have to establish right now when we have limited supplies. So as we have limited supply for testing, we are concentrating on the individuals that need to be tested. But soon, we will be able to test many individuals who may want to be tested.
And how do you determine who needs to be tested?
So there are 3 categories for testing. One is an individual that has been in contact with someone who was diagnosed. That's a criteria, and that individual have developed symptoms. The main symptom that we look for is fever. Someone who has fever of 100.4 or more and has been in contact with someone that was diagnosed, we wanted to talk to that person. We wanted to test that person. We are also testing individuals that have traveled to any of the affected areas and that have developed any symptoms. And also the hospital are testing anyone who may have a pneumonia and is hospitalized and has no explanation for why that pneumonia is happening. So an undiagnosed infectious disease will get tested for that. Those are the...
What about those people who have traveled internationally, but they've come in contact with a number of people, and they don't know for sure if one of those people was positive?
So in many cases, those are the individuals that we wanted to talk to on the phone. But we are advising anyone who has any concerns, monitor your temperature. Anyone who has any concern, monitor your temperature. As soon as you develop fever, isolate yourself as much as you can from your family and call us, and we will determine if you need to be tested.
What's the best number for people?
I will give you the number. Do you have the number, Ken?
Yes, you can call 407-723-5004. That's our call service. 407-723-5004.
Now, that number is open from 8 to 5.
Why not? Why can't you do it in Spanish?
Keep everybody here for the
Why can't you do it in Spanish?
Doctor, how many people are you monitoring in Orange County right now?
I don't have the number right now with me, but I can give you the Florida number.
One can't know everything. Can one?
Is it increasing from the last time we spoke?
Yes, the number of people that we are testing is increasing. We test, I could say about 5-6 people a day that from the clinical setting that has qualified in any of those categories, but that changes daily.
Doctor, how many tests do you have and how many do you need? What's the shortfall?
So how many collection kits? That's what I have. I don't have testing kit. I don't do testing. So collection kits in my possession today, I have 50. 50.
How many do you need?
So if we open it to the community, we are going to need thousands, and we are ordering thousands.
How far we are from a vaccine?
From a vaccine, how far out we are to find
I don't have an answer for that. I'm not involved in that. But what I heard in the news is about 6 months to a year.
Anyone else with questions? We are behind. Should we have been already testing the general public at this point?
So that's an interesting question. Of course, from a prevention point of view, you want to test as many people as you want so that you can identify who may have it or who have it and isolate individuals and cut transmission. That's what we are going to do next. Short of having all the supplies that we need, what we have to do is prioritize the people that we are suspecting has been in contact. And that's a subtle difference, but it's an important one.
Orange County case, the resident of Orange County. Can you talk about that?
I cannot tell you anything about that individual.
I'm sorry. Here's what I have. They were Orange County and they're from Orange County.
So there is an individual who lives in Orange County who went to South Korea, came back to California, was identified at the airport of entry as being at risk or exposed, and was placed in isolation. I don't know details about the date and when that happened or what kind of. The person passed away, and that's it will count the way that the CDC present these cases. The way that the CDC present these cases and why this is why we are giving the information, it will count as an orange case because of what the place of residence is. And you will see that in the data, and we don't want to misinform you. The person didn't die here. The person was never here after being diagnosed, but it will count. It will come in the webpage as an Orange County case. So that's why we are giving the information.
Looking at the extended period of time that parks are going to be closed, obviously that's a lot of lost tax revenue, bed taxes, and
so forth.
We have two questions going on. I'm sorry. Lewis is.
In the facility next week, how many more people per day do you anticipate being able to test?
So let me give you an answer a different way. We are getting prepared if we need to do drive-through testing. So we will test as many individuals needed as long as we have the supplies.
And as long as people can afford them, right? How much do these tests cost? I heard without insurance, they cost up to $1,600 for people to get tested.
I understand that part of the federal package includes resources for avoiding the fees for testing. In our case, when we test, it doesn't cost a penny.
Okay, I'm going to go to the back. What was your question one more time?
The theme parks, for example, are going to be closed alone. That's going to be a significant drop in bed tax dollars, sales tax. Have you guys started planning what kind of dent that could have on the county budget, the county services? And likewise, with Disney and Universal closing, SeaWorld, for example, is staying open. So what's your message, for example, to SeaWorld that's staying business as usual?
What I will tell you is this, is that each one of the theme parks have to make their own independent judgment about staying open. But even if they have closed their actual theme parks, many of their hotels and resorts remain open at this time, where there are still patrons who are staying there. In terms of what that economic impact will be on our community, it certainly will be significant. We can't quantify that to date, but anytime you have these major theme parks that operate and have tens of millions of dollars of revenues on a daily basis, it's going to be extraordinary. In terms of the overall economic health of Orange County, we're in great shape. We have strong, healthy reserves, and that is something that puts us in a good position going forward to be able to deal with the crisis at hand. We will leverage taxpayer dollars to be able to assist our residents here in this community to get through this period of time. We're just all hoping and praying that this will be a short-lived period of time, but it is, it is truly unknown at this point. And so we're going to have to make adjustments as we move forward. And so I would say to our community, just stand by. Your government hears you. We're here to work with our citizens. This is why you see this large contingency of local providers that are here today. Okay, there was questions on this side.
Yes. Mayor, your decision to recommend no gatherings or is that effectively closed or continue to the city
I don't think it effectively closes them, and this, by the way, will be effective beginning this Sunday. We do have some contracted relationships that we're going to have to work with those individuals who have rented facilities on trying to, again, make appropriate decisions going forward. But the reason why we have chosen to set the bar at the 250 is that we're simply trying to limit the exposure of the virus spreading within our community. And so we're going to have to take these very difficult measures at this time in order to hopefully prevent the spread from continuing. The Department of Health has said to me on a daily basis those numbers throughout Florida are continuing to climb. Because we have such a large tourist-based economy here, we have the busiest airport in Florida here within our community, and we have the 75+ million visitors who come here on an annual basis. A lot of people going in and out of here. It is just really nothing short of extraordinary that we don't have more confirmed cases than what we do today. By taking these measures, I believe that we strengthen the probability that we will reduce the spread, and that's why we're taking the measures.
You're not closing
we still have to provide some services to this community. With the fact that we're in the spring break for the public schools and many of our children depend on our neighborhood centers and localities to be chaperoned, we're balancing that out. Certainly, if we keep any of our facilities open, we will ensure that we have the appropriate protocols, to make sure that those centers are sanitized and that anyone participating in those activities, especially our children, have appropriate cleanliness while they're there in our facilities. Okay, Mayor Dyer.
And from the city side, a lot of the events, I'd say most of the events have self-regulated themselves. So we don't have any events at the Amway Center between now and the 1st of April, but we didn't necessarily cancel any. The promoters canceled them. The NBA canceled them. The Eastern Coast Hockey League canceled them. So I think that our residents and organizations are being responsible. And just because we say 250, there may be something that you have 200 at that you don't think it's a good idea to host that event. So we're recommending that, but there are things that will be held in city venues. For instance, weddings, if you're worried about your wedding that's at Lou Gardens, we aren't canceling weddings at Lou Gardens. We were canceling that big event, the plant sale that we're going to have this weekend. So we're being prudent and, case by case and take a look at things, and things are going to change in the next couple of weeks.
Specifically in things like Dr. Phillips Center and the Convention Center and Amway, you said they self-regulated on that. The bigger venues, it's still case by case based on the events themselves.
And Dr. Phillips Center has a lot of smaller events. They have weddings, they have things in the Pew Theater that are going to be less than 250 individuals, but I don't think they have any big ones between now and the time frame we're talking about.
For Dr. Kino, back to the testing. As I understand it, you said you're going to be getting tens of thousands of collection kits. But what's the infrastructure in the county going to look like for actually testing those samples that you collect? Will you have to farm it out to somebody else to get the work done? Will that work done here? And what will be the turnaround on the results?
So I didn't say tens of thousands. I say thousands. But yes, we will need as many as we can get our hands on it. So with regard to what the processes are going to be, the 3 state labs are testing for the coronavirus at this time. We are sending our samples to Fort Lauderdale lab. But the state also has a contract in place with the private industry. So if the need arises, we could send samples to the private industry as well. So we should not have a lack of capacity to conduct the testing.
All right, let me just say thank you to all of you. Our goal again today was to demonstrate a unified front as we respond to this pandemic in our community, and to reassure our public that we are working on their behalf to minimize the impact as best as we can. We will continue from time to time to give you updates. The updates in the future may likely come from the Emergency Operations Center as we continue to deal with this in the coming days. But thank you for being here this afternoon.